Do you ever wonder what it's like on the backside of a surgeon's office? Today, I want to talk to you a little bit about how surgeons look at the number of procedures they do and the surgical volume, and in particular, how I'm kind of wanting to change the model for how we work. I'm Father Goldberg. I'm the founder of Austin Orthopedic Institute and TDG Concierge Services. And over the last 25 years, I've performed over 11,500 joint replacements, and I love spending my time helping patients regain their mobility and function and get pain relief. And today, I want to talk to you a little bit about sort of the myth of what surgeon volume is or what it isn't. So as surgeons, we have been trained to do as much as we can. So when we graduate our surgical residencies or fellowship programs, we're trained to just keep going, get on that treadmill and just go, 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 go. And it's all about the volume. And over the years, we've had sort of introductions of things to try to slow down that volume, i.e. value. But value basically in medicine is basically, it's an outcome over cost. But what value really is means you're going to do that same volume, but you're going to do it with a bunch of check marks saying you've checked all these boxes that say you do quality. And when you do quality or you check the boxes, then you're going to deliver higher value and you should be potentially paid more. But what that doesn't do is encourage patients or surgeons to do less. And so what happens is surgeons continue to do as much volume as they possibly can, but with the check marks demonstrating that they do quality. So what I'm contemplating doing is actually shutting that model down as far as me. And so what I'm considering is actually limiting my practice. So let's take a family practitioner that has a concierge practice. So you know, when a family practitioner does concierge, they say, I'm limiting my practice to this number of patients. Let's call it 300 patients. And you know, if you're one of those 300 patients, you're going to get access to that doctor for the rest of that year. And then you renew it on an annual basis. But their practice is limited. There's no such thing in the surgeon world. Our practice is never limited. Our lifeblood of our practice is the recurring entrance of patients, new patients into our office so that we can fix them and then they go on their way. What I'm considering doing is actually creating a little bit of that family practice concierge model where I'm going to limit the number of patients that I operate on per year. What that means is that obviously my volume will go down. And so how do I do that thoughtfully and measurably? Well, I need to do as much volume as I can to maintain a proficient skill, right? I'm a relative expert, meaning I've done lots of surgeries and I've seen lots of things, and I know how to do these knee and hip replacements pretty well, and I'm pretty skilled at that. And so I always want to maintain that level of efficiency, and I don't want to lose that skill, but I also don't want to work so much that I'm too tired for my next patient. And the example I would say for you is, let's say I'm doing 850 joint replacements a year. If you're the patient, do you really want to be case 846 that year? You probably want to be kind of right there in the middle, maybe 500 is a good number, something like that. And so what I'm proposing to do is to sort of lock my practice down so that I'm doing enough volume to maintain proficiency, but be able to deliver this expert level of care and this more boutique level of care in the concierge pathway. So what that means for me, it's about 520 cases per year. That's about what I think is a very good, comfortable number that maintains my proficiency and doesn't sort of run me too tired so that I potentially can change the quality of my results. Not that I would ever change the quality of my outcomes for my patients. I'm always trying the best I can, but that's a good number for me, I think. Well, I still have to keep the lights on, run my practice. And so how would I do that measurably? What that means is if I'm doing all the volume, then I have all this income coming in so that I can keep the lights on. I don't need to make a gazillion dollars. That's just not me. I don't need to live in that way, right? So I don't need to become wealthy doing this. I need to have a nice life, pay my bills. I don't have an extravagant lifestyle. I don't have extra cars. I don't have extra houses, boats, none of that stuff. I just have a nice house, nice wife. So what I would like to do is limit my number of surgeries, but still be able to pay for my overhead of my office and take an income home. And so I'm going to categorize and limit the number of slots I have available for these different categories of surgery that I offer. So as you know, I have a concierge pathway. So I have a historical pathway and 3 concierge pathways to do surgery. And so what I'm going to do is for next year is I'm going to limit the number of slots available to each pathway so that if you want to schedule into a slot or schedule into a particular date, we'll have to choose a particular pathway that is available for that day. And so what that means is I potentially will fill an entire pathway for the entire year in the first month, because some people will wait 12 months to have their joint replacement by me if that's what they have to do. And so I hope that this goes over in a good way, that I'm trying to do the best I can to deliver the best quality of care and in the most boutique fashion. And I've interviewed lots of my patients, and the feedback on the idea so far has been excellent. And many patients say that they would upgrade and support a surgeon who wants to try to limit their practice to maintain their quality. I hope you find this video helpful. I'm always available for a consultation, and if you just want to talk about it, come on in. Hope you have a great day.